This is Med School Radio. Hello everyone, welcome back to Med School Radio. We're going to be talking about highly active antiretroviral therapy drugs and why they can cause fat redistribution in patients that are taking these drugs. So a patient may present to you and say that they are experiencing a redistribution of the fat. So you might see that their face is very thin, they're losing fat in their face and it's being redistributed around their body. So this is something to be aware of. So what I'm going to do is I'm going to look at Wiki and we're going to read a little bit about HIV-associated lipodystrophy. So HIV-associated lipodystrophy is also known as lipodystrophy in HIV-infected patients, and it is a condition characterized by loss of subcutaneous fat associated with infection with HIV. So how does this present? It commonly presents with fat loss in the face, buttocks, arms, and the legs. There is also fat accumulation in various body parts. And patients often present with a buffalo hump, like fat deposits in their upper backs. Breast size of patients, both male and female, tends to increase. In addition, patients develop abdominal obesity. So what is the cause? So it seems like the cause has not been fully understood. Let's read about what it says here. So the exact mechanism of HIV-associated lipodystrophy is not fully understood or elucidated. There is evidence indicating both that it can be caused by antiretroviral medications and that it can be caused by HIV infection in the absence of antiretroviral medications. So let's read a little bit about both. So firstly, evidence implicating antiretroviral medications. On the one hand, lipodystrophy seems to be mainly due to HIV-1 protease inhibitors. Interference with lipid metabolism is postulated as the pathophysiology. Also, the development of lipodystrophy is associated with specific nucleoside reverse transcriptase inhibitors, or NRTIs. And mitochondrial toxicity is thought to be involved in the pathogenesis associated with NRTIs. And the next one is evidence implicating HIV infection alone. So conversely, they say that there is evidence that HIV infection on its own contributes to the development of the lipodystrophic phenotype by interfering with some key genes of adipocyte differentiation and mitochondrial function on patients which have not received antiretroviral treatment. So this is very interesting to see these two different opinions. So we know that it has not been fully understood, but it is seen in patients who are taking these HAART medications or HAART medications. So something to think about if this type of question comes up on a test. So thanks for tuning in.